Hi, welcome to Fertility Talks. I'm your host, Mary Wong, and today we are going to talk about your ovaries and your cysts. And with us here, we have our one and only Tanya Smith, also a registered traditional Chinese medicine practitioner. And so, welcome.
Thank you. I love talking about ovaries and cysts.
I do too. So we actually were talking a lot already about this, and it's like, what do we include? So I'll just kind of let you lead the way.
Well, I think the first thing to talk about is that cysts happen. They're part of it, especially with stimulation cycles. It's really, really common to develop a cyst after a stimulation cycle. And so understanding that it's common and normal can sometimes alleviate some of the concern around it. So with a cyst, it's usually the kind of thing where it comes up and it resolves on its own. There's often not a lot of treatment for it, and most of the time you won't even know you have one. If the cyst gets really large, sometimes you'll feel some pressure or some discomfort, a little bit of extra bloating in the low abdomen. Sometimes there'll be a delay in the menstrual cycle starting, so sometimes with a stimulation cycle the next period may be a little bit delayed, also sometimes comes early. If there's a problem with the cyst, there may be extreme pain or bleeding, and that's kind of an emergency situation. So just a little red flag there, just to know that if you're in sudden terrible pain or there's bleeding, to make sure that you get it checked out right away.
And you would feel it really locally as well, right? Mm-hmm. So that local pain. I mean, there have been instances where there's an actual rupturing of cysts, mm-hmm. and that hurts like hell. It's an emergency situation, right? Yeah. Not typically not fatal in any way, but it's certainly really, really painful.
Yeah. So the reason that we wanted to talk about cysts is because it's one of the things that acupuncture and Chinese medicine is really, really useful at resolving. So in instances where Western medical doctors sometimes don't have a lot of therapies or solutions for helping cysts to resolve more quickly, we can definitely help in those kinds of situations. So,
well, they often will say, hey, let's see how big they get, and if they get like giant size, they actually go in there and aspirate it, like, so they'll suck the fluid out. So a little invasive, don't you think?
Yeah, and you want to address it before that happens.
Yes,
because it's really uncomfortable. Yeah. So we see cyst as kind of as a blockage or stoppage of the energy and the blood and the fluids moving normally in the pelvis, and they kind of start to build up a little bit. And so our solution is to help to encourage more movement of the energy and the blood and the fluid in the low belly, mainly by using acupuncture, and it's one of the best remedies for cysts.
So obviously you guys can't do that on your own unless you're an acupuncturist yourself.
Even still, you should see somebody.
Right, exactly. And so what else can you do? So let's talk about that.
What else can you do for cysts? Like manual therapy?
Yeah, like on you. So for example, castor oil.
Yeah. So castor oil packs are a really kind of easy DIY solution. So castor oil is a really thick oil, so you can do it a couple of ways. You can either soak a towel in it or just spread it on your low abdomen, apply some heat over top, and kind of let it soak in. So the castor oil has particular properties that really helps to get things moving, really helps to break things down, soften things, and get them back into circulation to help it resolve more quickly. So at our clinic, our massage therapist is a Mayan abdominal massage practitioner and has created these great castor oil packs for us.
So a piece of flannel, right? I mean, this one, you can make these at home, and you don't have to have like the beautiful little seams that she's sewn together, but this is organic even. So if you want to buy something, you can actually do that, but you can also just find old pajamas and whatever, gauze even, right? And soak.
Put the oil on it, soak it through, and then apply it over the area. So if you know the cyst is on the right, put it a little more towards the right. Usually I'll put some plastic over it just so that the oil, which is very sticky, doesn't get on your heating pad or your hot water bottle. Apply some heat over top and sit for about 20 minutes. And you can do this kind of every other day. in the part of your cycle where it's not your period and you haven't ovulated yet. So in those that window there.
Unless you're actually not trying to conceive.
True.
If you're not trying to conceive, you can still do it after your ovulation. Yeah. Just don't do it, during.
If you're possibly pregnant.
Yeah.
Yeah.
Exactly.
Yeah. Some other things that I like to suggest is a combination of kind of breathing exercises as well as visualization. So if we're using breathing into the low belly and the pelvis to expand that area and allow more movement of chi and blood and fluid in that area. And using your really useful brain to visualize this shrinking, to visualize it kind of resolving. So we are not we're not trying to force it to do anything. We're just asking it to resolve the stagnation, to help to get things moving in a normal way again. So we consider this kind of a blockage or a stagnation if we want it to go back into proper circulation.
Very good.
Yeah.
Yeah.
Yeah. So one of the things that we wanted to talk about, because we do so often work with fertility clients, is that sometimes a cyst will be present when you go in for your day 3 ultrasound. So you're visiting the clinic to see how things are looking for the upcoming cycle, and they find that there's a 2 centimeter follicle or a 3 centimeter follicle already, and this would be a cyst. There is a possibility that that cyst could interfere with sort of the expected progression of the cycle. So sometimes it'll change hormone levels or require more stimulation to get the follicles growing in a cycle where a cyst is there at the beginning. And so sometimes it can be useful to wait until another cycle where there is no cyst at the beginning to help with better outcomes. Mm-hmm. Or if you have gone for your day 3 ultrasound and they've decided to go ahead, it's still important to consider that there is something that's kind of accumulated and maybe blocking the normal flow in that area. And so if you are in a cycle that has started with a cyst, it may be even more important to get acupuncture in that cycle to help with the flow and to help make sure that the blood and the energy can move well, so that the follicles that are growing are very well nourished and they get everything that they need to grow into healthy follicles.
And how I add to this again is, so some people will say, oh my gosh, but won't the acupuncture make the cysts go bigger? And how we look at it is that the cysts, it's in an unbalanced state. So we're trying to bring the body back into balance. And by doing things like acupuncture and the castor oil pack that we're talking about, it helps to create that flow of energy. And so if we think about our blood flow literally being like a stream, and then a cyst being being part of a dam that breaks up that flow, then the acupuncture works to take out the dam, right? And when that happens, the cyst is not actually getting bigger. We're just trying to rectify the chi, the energy, the blood, and the static blood, the conglomeration that is sitting there, so that things are moving appropriately. You'll have better uptake of the drugs that you're actually taking in the ovaries, so it'll do the job better, right?
Absolutely, yeah. So I think it's really important just to recognize the cysts happen, and that there are things that you can do both on your own, as well as making good use of acupuncture during the stimulation part of the cycle if there is a cyst present.
And I know that a lot of doctors will not. Well, they don't really like people taking herbal medicine when they're in the middle of an IVF cycle. So what else can you take? There are other kinds of supplements that you can take. And, specific to your case, I would probably recommend you to see like a naturopathic doctor or other TCM doctors that practice more functional type medicine. And, but, there is such a thing called NAC that people use as an anti-inflammatory. It helps to move things along, breaks things up. So That's pretty safe, and typically the MDs are okay with you taking it because it's considered a supplement.
Mm-hmm. Exactly, nutritive.
And nutritive. So they can understand certain things, but then other times they're like, no.
Yeah.
Although I have seen, or we have seen, where let's say you have done multiple IVFs and it's not working out, then the physicians say, okay, fine, do whatever the hell she says, right?
Yeah.
That happens.
Everything's fine.
Everything is fine. So I think that's it for our tips. Anything else?
No, I think that was everything.
Okay.
Yeah,
cool.
just know that there's things that you can do, and that there's good reasons to do them.
Yeah, and there are always options. So, and if you have any questions, please contact us at aliveholistichealth.ca.
Yes.
You can check out our more posts through Facebook down here, or go through marywong.life, where I have like over 130 videos that you can look at.
Fantastic resource.
Thank you.
Yeah.
Yeah, that's why we do this, for you guys, right? And so, and if you haven't picked up my book, Pathways to Pregnancy, do so, because it's awesome. Okay, so we'll talk another day, and we'll keep this conversation going so that you guys are going to be well on your way to health, longevity, and fertility. Take care, guys.